Healthcare is unquestionably a hot topic. Two of the nation's most well-known and respected physicians are working now to shed light on something that's often unaddressed: the importance of adult immunization in communities of color. Dr. Regina Benjamin was the 18th United States Surgeon General under President Barack Obama. Also with us, board-certified internist Dr. Jorge Rodriguez. It's good to see both of you. Glad to have some time here this morning.
Thank you.
Thank you.
Dr. Benjamin, I do want to start with you and ask for an explanation about this. Why isn't this public health issue getting more attention in communities of color? What do you think?
Well, that's what we want to talk about today, is prevention. And prevention's been the foundation of my work as a family physician as well as Surgeon General. In fact, as Surgeon General, we released the first ever national prevention strategy. So we're here today to talk about the importance and the need for adults to get their immunizations, particularly for pneumococcal pneumonia. Pneumonia, as you know, is simply an infection that's caused by a germ or bacteria, and it can occur in anyone. But as we get older, we tend to have our immune systems to weaken, making us more susceptible. And so that's why we're teaming up with Pfizer to increase awareness about the need for adult vaccinations.
So is it, when you look at the disparities here with preventive health, what do you point to in communities of color where you feel like there is a shortage of what that's leading to that awareness gap?
Well, in both communities, first of all, pneumococcal pneumonia or any sort of pneumonias is not just in communities of colors, but what we're finding is that in those communities, for example, African American communities, only 50% or so of the people have been vaccinated, and in Hispanic communities, only 40. I think a lot of that is cultural. I think a lot of that is economic, having access to physicians. For example, I know in the Hispanic community, a lot of Hispanics don't go to doctors because of the language barrier. Maybe there's a trust issue. So that's why we're here today, and I appreciate you having us, is so that we can start breaking down some of those barriers. And I think just seeing us, on television goes a long way towards that.
And in the African American community, we're more likely to have chronic illnesses like high blood pressure, heart disease, diabetes, which makes us at higher risk. And so in spite of the fact that high risk exists, preventable services just aren't being consumed as much as we need to do. So we want to raise that awareness so people in the African American community and Hispanic community know that adult immunizations are important.
And
the same thing in the Hispanic community. I'm sorry.
No, please go ahead. I think it's important to hear from you.
I would say the same thing in the Hispanic community. Just because I think of lack of access of care, because of certain inherent things, we do tend to have more diabetes and more high blood pressure. And like an old professor of mine used to say, the sicker you are, the worse you do. So it's almost like a perfect storm. A community that tends to have more illnesses and an aging population that also tends to have a weaker immune system. And remember, if we prevent infection in one community, we're basically preventing the spread of that infection to all communities.
And prevention is the key. Prevention is the best medicine. So we encourage people to wash your hands frequently, to eat well, exercise, live a healthy lifestyle, and talk to your doctor about what's your status to make sure that you're up to date on all of your vaccinations.
I wish we had more time here, but I would like one website with more information about pneumococcal pneumonia, about prevention. Where would you send our viewers to follow up here?
Well, there are a number of very good websites out there. I'd suggest perhaps cdc.gov, which is an easy one to remember, easy one to go to, and there's a number of really good information there.
And your doctor is always your best source of information, so that's where I would go first.
Dr. Rodriguez, thank you. Dr. Benjamin, we appreciate it. Good to see both of you.